Did you know that 1 in 3 people will develop cancer at some point in their lives? It's a staggering statistic, and yet, here is what most people are not paying attention to. Every year, millions of cancer cases are diagnosed too late. Why? Because the early warning signs were missed. The truth is, catching cancer early can mean survival rates above 90% for many common cancers. But wait until stage 4, and those numbers drop dramatically to less than 20%. That's why today, I am sharing 8 subtle warning signs that could literally save your life or the life of someone you love. These are not the obvious symptoms everyone talks about, like lumps or unexplained weight loss. These are the quiet signals your body sends before things get serious. And trust me, they are easy to overlook. So let's dive in. Sign 1: persistent bone pain. Let's start with something most would not think twice about. Bone pain. Sure, we all feel sore after a workout or a minor injury. But here is the thing. If the pain intensifies over time, especially at night, it could be more than just fatigue. This kind of deep, throbbing ache might signal bone cancer or cancer that has spread to the bones. What makes this particularly concerning is how it disrupts your daily activities. Simple movements like walking or lifting objects can become excruciating. Some patients describe it as a relentless throbbing or aching that does not respond to over-the-counter pain relievers. If you notice swelling, tenderness, or even unexplained fractures alongside this pain, do not brush it off. Get checked out immediately. Early detection can make all the difference. Sign 2: eye pain or vision changes. Your eyes can tell you more than you think. Blurred vision that does not improve with glasses, strange flashes of light, or even a dark spot on your iris. These could be signs of ocular melanoma, a rare but serious type of eye cancer. Unlike migraines or simple eye strain, these symptoms persist and worsen over time. Advanced imaging techniques allow doctors to examine the internal structures of your eye, catching issues early before they escalate. If you experience persistent eye pain or vision changes, do not delay. See an ophthalmologist right away. Early intervention can preserve both your sight and your life. Sign 3: unusual skin rashes. Not all rashes are harmless. Leukemia, a cancer affecting blood-forming tissues, can show up as tiny red or purple spots called petechiae. Unlike regular rashes, these would not fade when pressed, and often cluster around pressure points like ankles or tight clothing areas. Understanding the mechanism behind these spots is crucial. Leukemia disrupts your body's ability to produce healthy platelets, which normally help prevent bleeding. Without them, tiny blood vessels called capillaries leak, creating these characteristic spots. If you also notice unexplained bruising or bleeding, do not wait. Make an appointment with your doctor as soon as possible. Sign 4: dark streaks under nails. A dark line under your nail might seem harmless, but it could actually be subungual melanoma, a rare form of skin cancer. Look for streaks wider than 3 mm, varying colors, or blurred borders. And if the pigmentation spreads beyond the nail onto the surrounding skin, it's a major red flag. Do not mistake this for trauma or a fungal infection. Get it checked, it could save your finger or worse. Sign 5: drenching night sweats. Night sweats happen to everyone once in a while. But if you are soaking through your pajamas regularly, and it's not due to menopause or a warm room, it could indicate lymphoma. Often, these sweats come with other symptoms like fever and weight loss. When your immune system fights cancer, it disrupts temperature regulation. Bottom line, chronic night sweats deserve medical attention. Sign 6: persistent heartburn. Heartburn happens, but when it's chronic and does not respond to lifestyle changes or meds, it could signal esophageal cancer. Over time, stomach acid damages the lining of your esophagus, leading to precancerous conditions like Barrett's esophagus. If you are having trouble swallowing food, noticing weight loss, or still dealing with heartburn after weeks of treatment, talk to your doctor. Early intervention can prevent disaster. Sign 7. Jaundice. Yellowing of the skin or eyes. Jaundice is one of the clearest signs something is wrong. While it can stem from various causes, sudden jaundice in adults often points to pancreatic or liver cancer. Tumors block bile ducts, causing bilirubin buildup in your bloodstream. If you also notice dark urine, pale stools, or upper abdominal pain, act fast. Early diagnosis is critical for effective treatment. Sign 8. Recurring fevers. Fever is not always caused by infections. A persistent or recurring fever without a clear cause could be linked to blood cancers like leukemia or lymphoma. These fevers often follow a pattern, spiking at regular intervals. Coupled with night sweats or unexplained weight loss, recurring fevers demand immediate medical investigation. Remember, these signs do not automatically mean you have cancer, but they do warrant attention. Knowledge is power, and catching cancer early saves lives. If this video helped you, give it a thumbs up, share it with friends and family, and subscribe for more health insights.